Hi, my name is Maeve Cohen, and this is my reflective blog module 3. Um, in the skills questionnaire, I scored highest in interpersonal skills, followed by administrative skills, and lastly, I scored the lowest, which was still moderate, in the conceptual skills. I am not a manager, so I can only speak to if I was a manager, the skills I would hope that I would possess. As a manager, I would use these skills. For starters, a good planner. I think planning can help you stay on track. It can also allow you to see what needs to be done in the future. By sticking to your plans and what you would like to have accomplished by a certain deadline can also allow you to achieve the larger goals and to stay on track to achieve those goals. I also believe staying organized is important, making sure that you have everything in order, and that way that also will help with your planning so that you know that all your information is organized and that you can stay on track to achieve those goals. Staffing. I think it is so important to listen to what your staff is saying. Um, I know that working in units that are consistently understaffed, the staff tends to be more frustrated and the morale does tend to be lower. In our book, it states as a nurse manager, it is in their position to monitor how successful a staffing pattern is and to provide input um, when a change is needed. I believe this is very important as this can allow nurses to provide safe, efficient care and also can increase morale. In one of the units in my hospital that I work at, the staffing has been consistently low. And what the managers were able to do is put a bonus where if you sign up to work an extra overtime shift in a certain amount of time, you'll get a bonus on your paycheck. So instead of nobody wanting to work and not pick up overtime and help a short staffed unit, this bonus allows the staff to say, okay, well, the bonus is worth it. I'm going to just suck it up and do it. And they have seen that they've been able to get help until their staffing can be fixed. Directing is another skill that is needed by our manager. In our book, it describes the 5 concepts that are included in directing. They are giving directions, supervising, leading, motivating, and communicating. When giving directions, it is important to give clear directions and to be consistent. You can also clearly state what you expect from your staff, and also if things need to get done, providing clear directions can help facilitate getting that task completed, and hopefully there won't be any miscommunications along the way. Supervising supervising is another task, and that doesn't only mean observing, but it also involves giving praise, offering feedback, and listening. Um, know the work that you are supervising and remain approachable. Leading also allows you to inspire and encourage your employees. Motivating helps employees find their strengths and weaknesses. And motivating also helps to address your weaknesses and can help move forward from your weaknesses and how to change those weaknesses into strengths. Lastly is communication, and I believe communication is just essential to anything in the healthcare field. Proper communication is essential, and it must be something that a manager can do. Second question is about the literature. I chose to read an article called Interprofessional and Interdisciplinary Collaboration Moving Forward by Sally S. Cohen. This article talks about the importance of interprofessional collaboration in our healthcare practice, in our healthcare practice, and how that can help research and create healthcare policies. The article uses an example. In 2009, 6 national organizations representing schools of dentistry, medicine, nursing, osteopathic medicine, pharmacy, and public health formed a collaborative to promote and encourage constituent efforts that would advance substantive interprofessional learning experiences to help prepare future clinicians for team-based care of patients. I believe that coming together as a team from different professions can help solve problems and allow different perspectives to be brought to the table and different issues. Thereby, this can help prevent errors in the long run. And when the article says interdisciplinary, it includes the ways that experts in different disciplines might interact as they study societal issues and problems for which no single discipline can provide solutions. I believe that this is very important, especially in the healthcare. For example, our facility was really promoting sepsis and the signs to help prevent sepsis and what to do when you do see those signs. And we teamed up with nurses, doctors, the pharmacy, as well as research, all teamed up to create a policy that we can follow to help better manage sepsis and the signs to look for. But I alone as a nurse could not implement this because I do not know what pharmacy is, what obstacles they face to get the medication there on time. I cannot speak for them, so by joining together as a team, we were able to come together and create a policy that is achievable by everyone. And by working together and allowing different views to be heard, we can improve the healthcare system, predict future problems in healthcare, and create healthcare policies to ensure patients are receiving the best care. Identify the levels and departments that you would need to work with in order to be effective in your role. First of all, I believe that in order to be a good manager, you need to have worked in that role that you are now going to be a manager. I believe this allows you to be a better manager and gives you a better understanding of what the job entails. You know what the staff goes through. You can relate to them. You can provide positive feedback. You can also provide the feedback of, I know that it's rough. I know that I have done that. And you can also provide ways that helped you get through those difficult situations. It also allows you to relate to your employees as you have once done the job. You can also see areas that need improvement and can offer suggestions as to how you can fix those areas. I find it's very hard for a manager to find productive solutions when they don't fully understand what the cause of the problem is. In having a preference for a vertical or horizontal structure, I have chosen the vertical organization structure, as it allows managers to have a more personable relationship with his or her employees. I believe it will also help employee satisfaction, as in this organizational structure, the managers manage a smaller staff and allows them to have more availability to meet with the staff and to go over concerns. It can also allow for a manager to know their staff. I know on a personal thing I went through was I had a family member pass away, and they were a family member that was very sick, and my coworker, my manager actually noticed that I was feeling a little bit down as I hadn't expressed this. She saw this, was able to be there for me, and to allow some leeway in my schedule. The horizontal structure, I don't think, allows for the more personable approach, as the manager oversees many people and many units, and in order to run those properly, there's many things that go into that, so they don't have as much free time. I did read in the book that many hospitals are adapting to this style. I did work in one hospital where they did adapt to this style, and I wasn't there very long after, but it didn't seem to have a very positive impact on the unit. It was, instead of our manager just managing our unit, she then took the job of many other units, and she seemed a bit overwhelmed. I can't speak for her, but she did seem a bit overwhelmed, and A lot of her time was spent in meetings and conferences, and she was not able to spend that time with us and trying to improve our unit. And that is it for my module blog 3. Thank you.